Prospect is obviously an acronym for Procedure-Specific Pain Management. It's a working group of anesthesiologists and surgeons who are experts in pain management, who've done a lot of research as well as clinical work in pain management.
Prospect is a group of both surgeons and anesthesiologists who are experts in postoperative pain management, and they perform systematic reviews of the literature where we evaluate the available scientific literature on certain specific surgical procedures. So for instance, we are not saying abdominal surgery, we are saying specifically laparoscopic cholecystectomy. For that type of surgery, we will be searching the literature, we will be identifying the papers that evaluate strategies that can be drugs, blocks, procedures, surgical techniques that try to improve postoperative pain for the patients. And we evaluate all of these interventions on their merits and then discuss it within the group and give recommendations, what techniques, what drugs, what surgical aspects you can do to reduce pain in that specific surgical intervention. And we have done that for about 25 surgical procedures, going from thoracotomy to cesarean section to ankle surgery to knee surgery to shoulder surgery, etc., etc. And regularly, every 5 years, we update those guidelines and those recommendations to make sure they're up with the most modern literature. It is a combination of surgeons and anesthetists, so it's not only anesthesiologists, because we value very much also the role of the surgeon in this process. And it is, as I said, and I want to underline this, procedure specific. So we're not talking in general postoperative pain, but really specifically for one intervention. And the purpose is that we can advise the anesthetists working in the field which is the best strategy to reduce pain in their patients.
The approach Prospect uses, the methodology of Prospect, to the best of my knowledge, no other guidelines have used that approach.
So we select a procedure first, cholecystectomy or hip replacement, knee replacement. Then we look at the literature, the randomized controlled trials, and the meta-analysis and systematic review. And we look at the methodology the author have applied, if basic analgesia is provided in both groups, in the control group and the treatment group. And then we look at the bias, the number of patients included in the study. And if we look at the difference in the pain, if there is really a benefit of the technique or the new drug we want to analyze. And also we look not only the benefit, analgesic benefit, but also the side effect. So if you propose a very nice way to treat postoperative pain, but it's too invasive or too dangerous for the patient, Prospect will make a caveat and probably will not recommend it.
The Prospect group has 16 people from different countries from all over the world, from the United States to Australia, Europe, everywhere. 16 people who are experts in postoperative pain management.
The initial motivation obviously was to improve pain care. And it was determined then, and it's still true now, is that pain management should be procedure specific and patient specific.
First, it was dedicated to anesthesiologists, but in the perioperative care of the patient to enhance recovery, you have a lot of healthcare providers involved. So I think Prospect can have a very large audience.
Everybody who is involved in perioperative medicine, so surgeons, anesthetists, patients, nurses.
Even the student, you can, when I give some lecture and course for the medical student and also the resident in anesthesiology, I take the example of Prospect to highlight the important point on the perioperative pain control. So the audience is very, very wide. Prospect is an advice and it's a guideline. So if you want to be aware of what is up to date according to the available literature to provide the best care to your patient, I think it's nice to read Prospect.